So 80% of people who have been told that they need to have a total knee joint replacement don't. It turns out that most of the people have either arthritis in one part of the knee, and they could have a partial replacement because the rest of the knee is healthy, or their arthritis is not so bad, it's not bone on bone yet, and they could have a biologic knee replacement where we regrow the articular cartilage and replace the meniscus cartilage. The last group of people, that 20% of people who have been told they need to have a knee replacement, usually do not need to have a traditional knee replacement. They could have one that we do by robotic control with bony ingrowth and the lack of cement use. So it's called an uncemented total knee replacement. And in that setting, we usually do not need to touch the kneecap, which reduces the risk and reduces the possibility of developing patellar pain. So for a host of reasons, people who are told that they need to have a knee replacement should explore the other options: biologic joint replacement, partial knee replacement, use of more modern techniques for knee resurfacing, where we use uncemented components with robotic guidance. We choose the procedure with the patient that requires the minimum amount of surgery to resurface their joint and permit them to get back to full sports.